Hi, it's Irnise, your nurse lawyer, back with one of my favorite modules, questions that need answers. It is a hodgepodge conversation about things that people have jumped into my DMs or are always reaching out to me to ask that I feel like let's put this in a conversation presentation so that I can send people here to reference this to get some of their questions answered. Here's my set of disclaimers, really important for you to review and understand. This also is in my course. And so any access that you get to my course or any purchases that you make, this disclaimer is embedded in that as well. So today we're going to talk about some of the key concepts of malpractice. We're going to talk about documentation a little bit, even though I do a whole almost hour-long conversation about documentation. And then there's a conversation where we talk about how to manage your patient's religious beliefs with your practice, which is something that I think is discussed, but not discussed as much. And then we'll talk a little bit about when to call ethics, risk, or legal. So one of the main questions that I always get in my DMs is, do I need medical malpractice insurance? And of course, depending on who it is, if you're a CNA, an LPN, a nurse, an RN, depending on what environment you work in, if you're a PA, NP, PT, MD, DO, like whomever, or if you're a student, it does depend on your status, requirements of the organization that you work for, as well as a few other things.